This is Bon Secours Share the Health. With some sound advice for men, here's Dr. John Port.
It is very important for men to come in for yearly physical exams, just as it's important for women to as well. Men tend to not be willing to do that as often. Men are at high risk of conditions, most of which are the same as women can have, such as heart disease, cancer, diabetes, high blood pressure, and we should definitely screen for those conditions as well as assess for their risk of having those conditions in the future. In general, we recommend men from the ages of 20 to 40 come in at least every other year for a preventative maintenance check. If during those checks we identify problems or we assess that there's risks for future problems, we may ask that they come in more frequently. At the age of 50 and older, of course, we recommend the same thing. Unfortunately, there's often other issues that necessitate follow-up more frequently than once a year above the age of 50. In general, in an annual physical exam, we'll assess your blood pressure, make sure that that is stable and controlled. High blood pressure is a silent killer, and we have to be very careful to make sure that it's decently controlled. We'll, in general, do a fasting cholesterol level. We will assess your prostate health through interviewing questions, as well as consideration of a PSA, which is a prostate blood test, and a digital rectal exam to assess the size of the prostate. We'll also talk about colon cancer screening, which above the age of 50, for most people, is when you start colon cancer screening. Many medical conditions will have no symptoms, so it is very important that we assess for those conditions and screen for them during a preventative wellness exam. So even though you may feel great and be very active, you still should come in for these checks for a screening test.
Good help is only a phone call away, and most Bon Secours practices offer same-day appointments. Call us at 359-WELL.